Hello and welcome to another episode of the Health Notebook. Today we're at the Hanslow residence and we'll be speaking to Mrs. Hanslow, who is a recovering stroke patient. Mrs. Hanslow, thank you for allowing us to come and visit you at your house.
Welcome.
Okay. Mrs. Hanslow, can you maybe just tell us a little bit about yourself? And I know, if I can just explain to the viewers, that you had a stroke recently. Can you just inform the viewers or just tell the viewers a little bit about yourself and the whole history pertaining to the stroke?
First of all, I'm not a blood pressure patient.
Okay.
This happened out of the blue, but I think I did a lot for the day, and I think that caused my blood pressure to shoot up.
Okay.
And in that, I didn't take notice. When my arm and my leg started feeling a bit numb, I just ignored it. And then I had a shower, and then I collapsed in a shower, and then I realized, no, this is something more than just what I was thinking was going to go away. And then the next morning I couldn't get out of bed. That's when I asked my husband to get the GP in, because I couldn't walk to the GP or get out of bed at all. She came and she took my blood pressure, which shot up to quite a big blood pressure. It was 200 over 120.
Okay.
Which was very abnormal, because I'd never ever had a blood pressure like that.
And how did you feel at that time? Did you feel lame on the one side?
Yes, or numb and lame, and actually shocked.
Okay.
Because I didn't know what was happening. And she took the blood pressure and she said, you know, she hasn't got all the equipment, I should come over to the surgery, which I did. And then she said she thinks I'm having a stroke, and she'll get arranged for a neurologist in the hospital as soon as possible. I must get dressed. And in an hour, say 2 hours, I was in hospital, and the doctor took me up. They had me came in X-ray, MRI, and it was confirmed that I did have a stroke on my right side of the brain.
Okay, and then I know you were in hospital for 2 or 3 days, and
I was 12 days in hospital.
Okay, so you were 12 days in hospital. And can you just explain to the viewers, how did you feel at that moment of time? So you had the stroke, you were feeling lame on the one side, and what happened in those 12 days?
Well, in those 12 days, they made me very comfortable. I was given physio, OT, speech therapist came, dietitian. I had all that comfort, and I worked hard and they worked hard with me, and I had to work hard in return. And I was really comfortable. After the discharge, I was supposed to go to the rehab, but then things didn't work out as it should, and I came home because there was some confusion with the medical aid. And then I came home, but before that my daughter came, and my son came from Joburg, and my daughter came from overseas. And they had things installed for me to make it comfortable should I get home.
So you came back, or you were discharged from hospital after they diagnosed you with a stroke. What was your expectations? You came home. How did it affect your independence, and what was your perspective of life then? Because I know we're so used to the normal daily activities, and it's only when something really happens to you that you only appreciate the smaller things in life. So can you just inform the viewers as well?
Yes, I was really worked up because it was going to be Eid, and I just came back from a trip, and I put everything aside and I just got jumped into it, and I couldn't manage actually. And I was getting really worked up, and that's what caused it. So I don't think there's a lot of things in life that you really have to ignore that isn't that important in your life, because I don't think there's anything more important than your health and your independence. And when you lose a bit of that or some of it, it really affects you badly, in a bad way. And I thought, you know what, I have to accept it. I have to get on with life, so I'm just gonna not worry about other things that are minor to me now that used to be important.
Okay.
So I got on with life, but when I came home, I was very pleasantly surprised because my children had the place altered. Should there be to help me along to find my feet, because it was going to be very, very difficult. Like, you don't always have the help that you expect from people and so on. And for me, it was, I wasn't used to people helping me. I was a very independent person, which is also very wrong, because you always need people around you.
Okay. We'll be joined by Tasneem Dalwai in a few moments. She'll be taking us through your house. As you've mentioned, you've granted us permission to actually show the viewers what adaptations can be made within the house.
And it does make life easier.
Okay, because I mean, I'm a medical doctor as well, and we only look at it from the one perspective in terms of diagnosis and treatment. But this is now to empower the viewers and to show them exactly, or give them a sense or an idea on how they can actually improve a patient that has a disability. So I'm really grateful that you're allowing us to actually take a walk through your house.
No, you do that.
Okay. Before we actually take a walk, can you maybe just give us some highlights in terms of the adaptations that was done in your house?
Well, it was railings in the passage down. It's not so long passage, but you do need help. Now I need that help. And like I said, I got the steps where I had to practice up and down to get my balance straight. I've got a bathroom was altered, just a walk-in with a hand shower, with a medical chair, and clippers on the walls to make my life a bit easier.
Okay.
And it does help a great deal.
Okay. Okay. Thank you very much, Mrs. Hanslow. We'll be taking a walk through your house now.
No, you do that.
We're joined by Tasneem Dalwai, who will be taking us through the house, and we'll be looking at the adaptations made to the household to actually make it easier for a stroke patient to perform functions within the house. Tasneem, welcome to the show.
Thank you so much.
So the first aspect that we're actually looking at is the railings in the passages. So Tasneem, could you just explain to the viewers what's the purpose of these railings in the passage?
Yeah. Okay, so if you have a look at the hand railing, you can see it's actually a nice height for a patient, and it's in line for them to actually get a good grip. So for example, if you have a patient with obviously the one side is affected after a stroke, they would obviously have poor balance, so this would then assist them with their balance, would give them better balance. And also if they're walking and they're holding onto the railing, we try to encourage them to hold onto the affected side, so they would then get also weight bearing on the affected side. So then putting weight on the affected leg, for example, to also then gain strength in that leg as well.
So as we can see, the railings actually follow the entire passage. Could you just also elaborate and just inform the viewers the reasons why the railings are there and in this particular manner, and is there any other options available besides railings?
Okay, so it goes right along the passage. So the patient then has access to all the places she needs to be for the day, whatever activity she needs to complete. For example, she needs to go into the kitchen, she can go into the kitchen, the bathroom, the bedroom, so she has support throughout the home for herself. And then also, like this is quite professionally done, but a patient could easily take homemade materials also just to assist on the side of the passage, just to assist them with walking.
And when you mean homemade materials, what can you actually advise the viewers?
Well, certain handlebars, like for example, you get plastic handlebars that are often used in bathrooms. And if the patient does not, for example, have access to handlebars or railings, they can then use assistive devices or help aids, such as walking sticks or walking frames to assist them with walking and balance.
Okay. Can you maybe take us through the rest of the household to show the viewers? We're in the shower now, and Tasneem, can you maybe just guide the viewers and explain them what adaptations have been made for this particular stroke patient?
Okay, so as we all know, I think after a stroke, one of the most scariest things for a patient is actually bathing or showering or using the bathroom, because for them that's the most dangerous place because of slipping and water, things like that. So if we just look closely, the first thing is that the flooring has increased friction, so it's non-slip tiles that is used for the bottom. So it's non-slip tiles that are used for the floor, for the bottom of the shower. The shower is at ground level for easy access, so the patient is able to walk in, and if the patient is in a wheelchair, for example, they can just roll into the shower directly without having to lift their feet and step into the shower. If you look a little closely, this is a shower chair, and this is used for also to assist the patient with balance. For example, if a patient is not able to stand due to poor balance, and also it's just safer if the patient is sitting in the shower. So then also the chair also has
rubberized feet.
Yeah.
Okay.
Yeah.
So if you look at the feet of the chair, it has rubber feet, so also to assist the patient to not slip and for the chair not to move. So it's stable for the patient. Okay, so if you look at it closer, there's quite a few handlebars here to assist the patient in the shower. So the patient, if the patient needs to lift for anything to reach the soap or anything, then they are able to grab the handlebars. And if they need to get out of the shower, reach for a towel, there's 1, 2, 3, 4 handlebars. So it's a lot of support for the patient as well. So if we have a closer look at the shower head, you can see the shower head has quite a long extension pipe, and it's a hand shower. So for a patient that is sitting, they're able to reach it, and they're able to reach various parts of their body because it's quite long. Yeah, and this is a lot safer than having a shower head quite high for a patient that has to maneuver and move their body around to reach the water as well. If we have a look at this tap, the tap is also moved quite low down, so it's a good level for the patient to reach also if they want to rinse their feet, for example, or their hands. So a toilet, for example, can also be adjusted in a similar manner with also extra handlebars for a patient to hold on to when they're getting off the toilet and getting on the toilet. And then also with a patient who may have a very low toilet, it can also have a raised toilet seat put on for the patient to actually sit down with ease.
Okay, Tasneem, you've just taken us through the house. We've looked at the adaptations that were made. What other important factors actually play a role in assisting the patient? If you could just highlight that to the viewers.
Okay, I think some of the important things is also the role of the family, which is very important. And I think, like I spoke previously also about educating the family on the stroke and the effects the stroke has for the patient. So for example, practical things that the family can implement at home is also just to motivate the patient every single day, all the time. Encourage the patient to do the exercises that they've done in therapy.
Okay, and in terms of exercises, in this particular patient, what type of exercises would you advise?
Okay, so muscle strengthening exercises on the affected side, but also with occupational therapy, we look at bringing the exercises into the patient's daily life. So it's not just to sit one side and do the exercises every day, but incorporating that within the patient's daily life. So for example, when the patient gets up in the morning, to do certain exercises within the getting up process, or going to the bathroom, incorporating certain muscle strengthening activities within the getting in the shower and going to the toilet.
So it's not just a once a day exercise program. There needs to be episodes during the course of the day. So it's not just getting up in the morning and doing these exercises. There needs to be other activities as well during the course of the day that actually requires the exercises.
Yes, but like I said, it's not separate activities that you have to do to strengthen. It's the actual activities that the patient is already doing that's actually strengthening the person's muscles. So that in itself is exercises. So for example, in a kitchen, if a patient is making a simple sandwich, and to bring in then the exercises that was done in therapy within that to strengthen the hand, looking at the fine motor movements within that activity.
And you've mentioned the family as well. Now, in terms of family, what role do they play?
Okay, so firstly, very important, motivation. Motivating the patient all the time is very important. A patient can get very demotivated if the recovery is sometimes slow. So motivating the patient is key. And then also just assisting the patient with activities, with the exercises, if they might need assistance, because some patients are not that independent yet. And then also just encouraging the use of the affected side and incorporating the affected side into the activities. So for example, reminding the patient to use the affected hand or the affected foot and to look to the affected side if they are neglecting that side as well.
And just to inform the viewers as well, each individual patient has his own unique learning curve, and it's also about, then it would be about understanding and having patience and giving them the determination to actually continue, because there will probably be times where they feel they're not improving after a few days, and I think that's also important, that the recovery process is not immediate, but it takes a gradual period of time.
Yes, on that I think it's also just very important to note that each patient has their own goals. So for example, we might find that it's important to work on walking, but actually the patient wants to actually just use the bathroom by themselves and that independence for them. So always look at what is priority for the patient, and I think then the patient is a lot more motivated if that is actually their goals and it's something that they want to work towards as well.
Okay, now for the viewers out there, if they would like to make these adaptations to their house, what would the process be?
So the first step would then be to get an occupational therapist who is able to do home visits, and then also just specifically look at assessing the patient in terms of what are their difficulties within the environment. So once they have identified what is challenging for the patient, it may be bathing, it may be cooking, but identifying the specific areas that is a challenge for the patient. And then the OT would then be able to recommend what adaptations can be made based on the patient's unique challenges.
Okay. So for example, in this particular case, it would be the hand railings, it would be the railings in the bathroom. So each individual case is looked at uniquely, and the adaptations are recommended via the occupational therapist.
Definitely, but very specifically to the patient.
Tasneem, Dalwai, it's been a great pleasure having you on the show, and we look forward to seeing you again.
Thank you for having me.
Thank you for watching. Stay tuned for another episode, same time, same place, next week.